Most people, when they think of Parkinson's disease, they imagine people who are older and getting up in age. And what many people do not know is that Parkinson's disease can also afflict persons who are pretty young, people in their 20s. The best way for us to illustrate this disease would be for us to examine a case study together. Stick around. A 28-year-old man developed progressive stiffness and pain in the lower extremities that was accompanied by pain in the lower back. He was also experiencing spasms and cramps in the legs with physical exertion. This led to the development of a broad-based gait that affected his walking. At this point in time, he went to see a neurologist who examined him and diagnosed him with stiff man syndrome because there was no better diagnosis to fit the symptoms that the man was complaining of at the time. In the 3 years following that, he developed rigidity and a fine tremor mostly on the right side of his body, and also developed difficulty performing delicate tasks. What he noticed, however, was that if he got a good night's sleep, then he would perform better the next day. And he was complaining of increasing anxiety and depression. He also reported that there was no history of neurologic diseases in his family, nor was there a history of any marriage between blood relatives in the family. At the age of 35, he went to a specialty clinic for further evaluation. At that time, he was complaining of weakness on both sides of the body that was accompanied by hyperactive reflexes in the lower extremities. He was still walking with a broad-based gait at that time and was still having pain in the legs and in the lower back. He had also developed rigidity and stiffness in the arms that was accompanied by a fine tremor that was more pronounced on the right side and that appeared both at rest and with movement. By that time, he had developed a mask-like facial expression that is commonly seen in Parkinson's disease. His MRI at the time was negative, and a trial of levodopa, which is a drug that is used to treat Parkinson's disease, and which usually causes an improvement in the symptoms if one does have Parkinson's disease, did not produce any improvement in this man's symptom. A DAT scan, a DAT scan, which is a special SPECT scan, a type of CAT scan that is used to diagnose Parkinsonism and Parkinson's disease, showed marked abnormalities in the basal ganglia on the left side of the brain. This suggested a Parkinsonian syndrome, and because of that, the man was started on a high dose of levodopa. 3 years later, all of his symptoms had improved. The stiffness and the slowness of motion and the muscle pain had all improved markedly, and the tremor was almost gone completely. He was now able to walk for considerable distances without developing fatigue or exhaustion. Genetic testing at the time showed two deletions in the PRKN gene, which was the cause of the man's Parkinsonian symptoms. Parkinson's disease is the second most common neurodegenerative disease in the world after Alzheimer's disease. It is caused by the degeneration of the basal ganglia in the brain that leads to a depletion of dopamine-containing neurons in the brain, which are essential for the modulation of our movement. These changes produce the typical symptoms of Parkinson's disease, namely the tremor at rest, the bradykinesia or the slow motion, slow movement, the cogwheel rigidity, and in some cases, a gait instability. Now, typically, Parkinson's disease appears after the age of 60, but in about 3 to 6% of cases, it can appear in persons below the age of 40. When Parkinson's disease is diagnosed between the ages of 21 to 40, it is called young onset Parkinson's disease or early onset Parkinson's disease. If we diagnose Parkinson's disease before the age of 21, then it is usually called juvenile Parkinson's disease. Young onset Parkinson's disease is frequently hereditary, and 20% of patients with young onset Parkinson's disease report first and second degree relatives with Parkinson's disease. Young onset Parkinson's disease progresses more slowly than late onset Parkinson's disease, and patients with young onset Parkinson's disease develop side effects, movement disorders from treatment with levodopa more often and earlier than the patients with late onset Parkinson's disease. On presentation, they present with slowness of motion and muscle stiffness more frequently than tremor, and they develop cognitive deficiencies less frequently than patients with late onset Parkinson's disease. However, they are more prone to the development of psychological symptoms such as anxiety and depression. These differences between the two types of Parkinson's disease, the young onset and the late onset, are significant enough to warrant different approaches to treatment. And providers will often start patients with young onset Parkinson's disease on dopamine agonists so as to delay the onset of the dyskinesias and the movement disorders that frequently accompany levodopa treatment in Parkinson's disease. Any patient with young onset Parkinson's disease should be evaluated for secondary causes of Parkinson's disease, such as Wilson's disease or drug-induced Parkinson's disease, because these are often reversible with treatment. I hope with that anecdote you gained an insight into the nature and the characteristics of young onset Parkinson's disease. Give this video a like if you enjoyed it, share it with your friends and family, support the channel by subscribing. Until the next video, stay healthy and stay safe.